So I want patients to understand that physical activity, we encourage it and is recommended to be performed daily. But depending on where they are at in their cancer rehabilitation, if they are post-surgical, they have to follow up the protocol from the surgeon. If they had required radiation, they shouldn't move the affected arm above 90 degrees for doing radiation and after 6 weeks. They can do a lot of trunk mobility. They can work on posture, but they shouldn't do repetitive motion during radiation and 6 weeks after. If they're clear to return to all activities, I encourage patients to do a group of different exercises, which include flexibility and stretches, because that is going to prevent scarring of the tissue and is going to enhance lymph flow. They can return to resistive exercises, including lifting weights and using resistive bands, but they have to pay close attention to strength training, because as they're doing repetitive movement with weights, it can increase their blood flow to that area. So it can actually trigger or worsen lymphedema. Aerobic exercise, everybody should be walking or jogging, cycling, swimming, because it actually involves larger muscles and is going to actually help them feel better, because it's going to also affect the cardiovascular fitness. It's going to manage the weight, and is also going to help improve the lymph flow and the venous return. So if patients want to return to more strenuous exercises, such as heavy lifting, playing tennis, golfing, or anything that requires constant repetitive movements, we do recommend that they do wear compression garments prior to initiating the exercise, during the exercise, and to maintain and have those compression garments on for at least 2 hours after exercising. And some of them, and they should be fitted correctly to their arm. But patients should not be scared about exercising, but they have to be cautious about it. They should really reach out to their medical team before initiating, and it should start as a low-level activity and progress accordingly.